everyone, I'm Dr. Sudhashini Chandrasekaran. I'm a consultant ophthalmologist from Columbia, Puchong. In conjunction with the World Glaucoma Week this week, I would like to share with you some information about glaucoma. Glaucoma is a group of diseases that has one thing in common. They all damage the optic nerve. The optic nerve is the main nerve in the eye that brings the visual information from the eye to the brain. So when this nerve is damaged, it causes our visual field to be affected. So we are unable to see certain parts of the visual field. Eventually, this leads to blindness in the end. So even though we are unsure of the exact cause and mechanism of how this disease happens, there is a definite link to intraocular pressure. So the higher the intraocular pressure, which is the pressure inside the eye, the more the damage is to the nerve. But sometimes it can also happen with normal intraocular pressure. However, because this is the only modifiable factor that we are able to control, most treatment of glaucoma aims at controlling the intraocular pressure in the eye. Glaucoma is one of the leading causes of irreversible blindness around the world. Irreversible meaning once the blindness has occurred, it cannot be reversed. Thus, it is a serious condition, especially because initially it does not show any symptoms until late when a permanent damage has occurred. There are many risk factors for glaucoma. Some cannot be changed, such as age, which is the most common risk factor for glaucoma. Other than that, family history. A strong family history, for an example, when you have parents or siblings who have glaucoma, you're definitely at a higher risk of getting glaucoma. Other than that, race is another factor. For an example, there's a certain type of glaucoma, which is the angle closure glaucoma, which is more prevalent among the Chinese people. Apart from that, there are some risk factors that can be controlled, such as diabetes mellitus. If you have good sugar control, you are at a lower risk of progression of glaucoma. And then hypertension is another disease, and that is linked to glaucoma. And also sleep apnea. If you have any reason to suspect that you have sleep apnea, you should get yourself checked, because this is also a risk factor for developing glaucoma as well.